Well, May is Melanoma and Skin Cancer Awareness Month, and health experts are reminding people about the importance of early detection and sun safety. Melanoma is considered one of the most serious forms of cancer, but doctors say catching it early can make a major difference.
That's right, and this morning joining us to talk about skin cancer risks, the warning signs, prevention, and treatment is Dr. Ogunsiakan from Dermatology. Welcome, Dr. O. Thanks for getting up so early with us this morning. So tell us, what is melanoma?
Melanoma is a form of skin cancer that originates from the melanocytes in the skin, the same cells that give our skin its color.
Okay.
And what makes melanoma so scary and dangerous is that it can spread easily to lymph nodes and internal organs, making it a deadly form of skin cancer. But the good news is that early detection is life-saving, and that's why it's important to get routine skin cancer screenings.
And so why is it so important this time of the year, especially to pay really close attention to those things?
Yeah, as we're moving into warmer weather, we love spending time outdoors, and it's important that we're taking that extra effort to protect our skin from the sun. So making sure that we're wearing sunscreen that's at least an SPF of 30 and also broad spectrum, reapplying every 2 hours, and making sure that we're avoiding direct sun exposure as much as we can. The work we put in today is going to help reduce our risk for melanoma in the future.
We know in your 7 day, there are many days with lots of sunshine, high temperatures.
Yeah.
Does it seem that the cases are becoming more common of melanoma?
Yeah, the cases of melanoma have been rising in the past decade, and that is partly because we have gotten better at detecting melanoma early, which is good. And when we detect it early, it's very easily treated.
What about your office? How do you guys help to educate patients about this risk and how to prevent it, especially this time of the year when we're talking about temperatures getting so warm and all the sunshine that people here in the Carolinas love being outside and enjoying?
Yeah, at Dermatology, during our skin cancer screenings, this is basically a teach-in session. We review the warning signs of melanoma and what to look for, and we also discuss sun protection as well. It's important to equip patients with tools to allow them to protect their skin from the sun and also be able to detect any warning signs in between appointments.
What are some of those warning signs?
Yeah, so for melanoma, you want to look out for the ABCDE. So it's easy to remember. A is asymmetry. So if you cut the mole in half, if it looks different on both sides, that's concerning. B is border. If you have jagged borders on your moles, that's a concerning sign as well. And C is for multiple colors. So if there are areas that are pink and dark brown and tan, that can be a very concerning sign as well. D is diameter, greater than the size of a pencil eraser. And even though melanomas can be smaller, that's something that you can just look out for at home. E is for evolution, changes like rapid growth, change in color, change in shape. Any of those are enough to come in and seek care from a dermatologist.
So if somebody has something on their skin and they're worried about it and they come and see you, what are your treatment options moving forward?
Yeah, so it depends on what type of skin cancer and also at what stage we find the skin cancer. For smaller and early skin cancers, we can even treat with non-surgical procedures. And for most skin cancers, we treat with a small surgery in office. If it's in an area like the face, just a cosmetically sensitive area, we refer patients to Mohs surgeons because we don't want to remove too much normal skin in those areas. And for advanced melanomas, we can refer them to a surgical oncologist.
Let's talk more about sunscreen, because I'm sure you've heard this probably hundreds of times. Everyone needs to wear sunscreen.
Yes, everyone.
And I should add, including people of color, because people will think, oh, I don't need sunscreen, but you actually do.
Yes, everyone needs to wear sunscreen to help reduce our risk of sun damage and skin cancers. In people of color, the risk of skin cancers is lower. However, there is still that risk, and it's important that we take that effort to protect our skin from the sun.
And if someone does have melanoma or another type of skin cancer, and you were talking about something like a mole removal, is that done in office? I heard you mention a mole surgeon.
Yeah, so Mohs surgery is a specialized skin cancer surgery that is done in office typically. Okay. So most of these procedures we can do in office.
Okay.
Yeah.
What is the average age that you're saying people coming in and they're noticing something on their body?
It depends on history. So if you have history of tannin bed use, history of blister and sunburns, and also family history of skin cancer, it's a good idea to come in early.
And should you be going to a dermatologist once a year like you go to your regular doctor for like an annual checkup?
This also varies depending on history. I think most people should see a dermatologist at least every 2 to 3 years for a skin cancer screening. If you do have history, family history of melanomas or a history of tannin bed use, then I would recommend at least once a year.
All right, Dr. Ada Ogunsiakan from SC Dermatology. Thanks so much for joining us this morning.
Thank you so much for having me.